Next, we have Rosie from New Jersey. Let's cue up Rosie's story.
So my story is the intersection of DFA and 50-state strategy in Flemington, New Jersey. 2007, the Democratic candidate won by one vote, and the court ordered a revote. Now, Flemington's the Republican county seat of a very Republican county, but DFA is a permanent progressive community here. We knew about what Governor Dean was doing at DNC, so we knew about the DNC organizers fanning out all over the country. In fact, the DFE staff, the DNC staff in New Jersey told me their very first call and their first day of work was from me, wondering when the hell they were going to show up in Hunterdon County. So the revote was in frigid February, and we had to move fast. The DNC organizers came and set up camp, Colleen Montgomery and Mary Campbell. They drove our GOTV, and DFA people from all over showed up. Most of them had gone through the DFA training, so they were on task and effective. We won that election by far more than one vote, and we learned so much from Mary and Colleen that we'll run every election from now on with that same drill. And here's the thing. The night we won, the next candidate announced, Linda Mastaloni, our very first homegrown, straight-out-of-DFA candidate ever. We got her elected, too, with a very DFA team. And with that win, the Democrats now run the council in this very Republican town, which means we shifted the direction of this town. Better treatment of immigrants and tenants, a mass transit policy, sensible budgeting, and maybe a community garden. 50-state strategy changed the country, but before it did that, it changed everything in my little town of Flemington, New Jersey. And we wouldn't have been ready without DFA. Thank you, Governor. It's Rosie Eftham from Hunterdon DFA in DFA, New Jersey.
We actually have another story, and this one's a great one, too. It's from Bill in Columbia, Missouri. He's got a story to share with us, and actually it's quite a bit of DFA stuff to share with us. So let's cue up Bill.
Hello, DFA. This is Bill Monroe in Columbia, Missouri, calling in on my Credo DFA wireless. I would say the most important and wonderful thing about DFA, as far as I'm concerned, is all the great people that I've met and contacts made here in Missouri and around the country, and how we've been able to harness the energy of folks to really transform the Democratic Party here in Missouri and help get people elected. The training that Matt and Arshad did here in 2007 was wonderful. We had about 100 people that came to that, and everybody was blown away at the high quality of it and the presenters that were there. One of the folks that later ran for Attorney General of the state of Missouri was there as a panelist, and he was impressed by the fact that one of the presenters at the training was someone that he's had in his to-do list to get in touch with. These were really high-powered folks that were brought into mid-Missouri, and it was much appreciated by everybody. We're planning to do another one of those this September, and I'm hoping that we'll get an even better turnout with all the fired-up Obama people coming to it. All right. Thank you, Jim. Thank you, Hard, and Arshad and everybody, and let's have a great party. Thanks. Bye.
You've heard from four people who have different experiences at different parts of the country, but I think there's a common theme. The common theme is that when people get together and when they work together and they really have a vision for progressive change, we work hard for it, we can accomplish great things. What I want to do is actually switch it over to you guys to do an introduction of a man I think you know quite well. The person who founded our organization, he ran for president, as you all know, and maybe that's how a lot of us started to get to hear him. But what he did was give us a vision and give us an idea of what we could do. He challenged us to work in all 50 states. He challenged us to get involved in our own neighborhoods. He said that voting is great. Sure, fine, vote. But then he said, if you really want an A, if you really want to participate in this democracy, you need to run for office. And he's a guy who we decided, even after he didn't become the president, sorry about that, but we got him to become the DNC chair, and he changed the way we did politics in this country. He changed the way we get elected. He changed the way we organize a party, and he did it all because of your help. So it's really not about me emceeing a call. It's not even about the guy I'm about to introduce. It's about you guys. So what I'm going to do is one more time turn it over you to welcome our founder, former governor of the state I'm living in right now, former DNC chair and a man who's come back to DFA. I'm going to unmute the phone on the count of three, and I want you all to welcome Governor Howard Dean. 1, 2, 3.
Now that we've totally decompensated the phone system.
Yeah, right? So, Governor, thank you for joining us on this call. And you're joining us from D.C., is that right?
I'm joining you from Washington, D.C.
Right.
Well, look, thanks, Arshad, for all your hard work. Jim, thank you for everything. I'm not doing this full time. Jim and Arshad are still very much in charge of this, but I really appreciate the opportunity to come back and work with DFA to get one of the biggest priorities of I think the American people through, and one of the biggest priorities of President Obama through, and that's health care. Look, I'm not going to, we could go on forever on health care because it's so complicated, but there's really three simple things you have to remember about health care. The first is that we've got to stop the insurance practice of telling people if they're sick, they don't get to buy insurance. So no more pre-existing condition. That's something called guaranteed issue. And the insurance companies actually are so scared of health care reform, they've actually agreed to do that after resisting it for decades. This is something we put in Vermont when I was governor, and it served us very, very well. The next is something called community rating. That means that you can't charge somebody who's 60 10 times as much or 5 times as much as you charge somebody who's 25. You've got to charge them pretty close to the same amount. If you do those two things, suddenly the insurance system works better. And we did those two things about 15 years ago in Vermont. And that's in President Obama's bill. However, those two things are great, but they're insurance reform, they're not health reform. The only part of Barack Obama's bill that's real health care reform is to allow ordinary Americans to choose a public insurance program, which will be something like Medicare if it's not Medicare. The byword that Barack is using is, if you like what you have, you can keep it. That's very, very important. And I like this plan better than any plan that I've seen in the last 35 years because it can pass and because it gives the American people a choice. But right now, the health insurance industry and the Republicans are working very, very hard to make sure that we don't have a choice, that we still have to go with the broken system. And putting billions and billions of dollars into the system we already have makes no sense at all. So I think it's really clear what our position needs to be. We want President Obama's plan. We want the plan that he promised us during the campaign. He's going to fight for that plan. We're going to fight for that plan. But if for whatever reasons the Republicans decide they don't want it and they manage to make it stick, despite the huge majorities that we have in the Congress and in the Senate, if for whatever reason the public plan isn't an option,